Can I just welcome you all to Adult Services Scrutiny panel, and welcome to Councillor Mike Locke. Thank you for joining the panel. And first item on the agenda is apologies. Liz?
We've received apologies from Councillor Victoria Holland, Erica Kirshner, Paxton Hood-Williams and from Helen St John, Chair.
Thank you. Disclosures of personal prejudicial, I can't ever say this, prejudicial interest. Any? Thank you. Prohibition of the whipped votes and declaration of party whips. Item 3. Minutes of the previous meeting. Item 4. Can you say something there? Chris, you declare an interest.
I declare an interest, okay.
Thank you. Liz will get you the papers. All right, we go through to minutes of the meeting on Monday, the 7th of August. Go to page 1, page 2, and page 3. Can I have a vote that everything is correct on those? Thank you, Councillor Jeffries. Seconder?
I'll second, Chair.
Lovely, thank you. Fine. Public question time, Liz. Is there any public questions? Oh, God grief. We're going like a rate of knots here. Performance monitoring. Over to you, Amy, or do you want to
Yeah, I'll just
say
make a couple of comments if that's okay. Thank you. Yeah, thank you, everybody, and thank you to Amy and Helen and all the officers for preparing the report. Just wanted to put into context, it's the July report, so obviously heading into the summer holiday period, and we do still have some staff vacancies, and so with the increased inquiries coming in, the team are under some pressure, but hopefully, as you can see, still performing well. It's really good to see that staff moves back to the Guildhall are helping promote those collaborative conversations. Lots through the report in the narrative, lots of different teams moving into Guildhall have reported that that's really helping things. Bonnermine House had an excellent inspection report in July and continues to have very good outcomes. But we are seeing in both residential and community reablement an increase of referrals of people who are described as being medically fit but unwell. So the reablement input is being delayed, and no doubt that's, you know, pressure our health colleagues are under to move people out the door and onto us. But it's obviously might have an impact as we go forward. External domiciliary care is continuing to remain stable, and we're looking at how we operate our internal long-term care offer going forward. Regarding residential care, again, it's a positive picture in terms of stability and how we're working with health and across adult services. Still, the workforce pressures obviously remain, as we've discussed previously. Day services continue to attract more referrals and attendance is increasing. The work around direct payments, which you heard about in more detail last time, is going well. Personally, I think there is a concerning trend of increased safeguarding reports from the community and some very distressing cases for the team to be dealing with. But obviously work is being carried out to look at that effectively, and you know there are robust processes in place to support our teams. Those are just a few things I wanted to pick out and highlight. I'll hand over to Amy for a bit more detail.
Thank you, Louise. Over to you.
Thank you. Yeah, I think it's we are seeing an increase in contacts to service. I think that's fair to say. So as I don't want to repeat no, I don't want to repeat what Louisa said, but actually it's a sort of picture across all the teams. So whether that's our colleagues, our integrated teams around therapy assessments, or whether that's within our social work teams, our safeguarding team, our referrals for care and support, you know, in terms of day services, etc., people attending. So I think that's a bit of a theme. We've had a slight impact around staff vacancies, workforce pressures, as been mentioned, but also the holiday period, which we're pleased to encourage our colleagues to take breaks, you know, and we want to support them because it's a continued pressured time for services. We are still identifying a high number of carers, and whilst we appreciate our staff are paid care staffs, we know there is a huge amount of unpaid carers in the community, and we want to identify and support as many of those as possible. And we continue to provide assessments for carers and provide care and support where required. We've co-produced a new carers assessment and some associated training that goes with that as well for our teams. So that's been co-produced with carers with representative groups as well. So we're pleased that that's being implemented. It's been a bit of a long process to get to this point. Residential reablement, as Louise mentioned, we've had an excellent CIW report around Bonamine, but we're getting excellent results of people. 83% of residents have returned home with no care over the last 3 months average.
Brilliant.
Yeah,
it is brilliant.
Yeah, absolutely. And those who are returning home with care as well, it's a sustained package of care as well, which is good. It's not increased, so that's it's really good. The details are in the report itself. Same as residential, community-based reablement. We're seeing high numbers of people, an increase on 9% over the last 3 months of people going through that service as well. So it's good news. That means more people are offered support, and those who are leaving independent as well, is around just over 50% of that service people require no ongoing care. We would expect that number to be less than the residential. There's been an increase in the amount of number of respite stays provided within our internal residential services. So that supports both those with care and support needs, but also the carers. So we're pleased to report that. And also whilst the numbers behind the day service as well, increase in referrals, but also a significant year-on-year increase, which is good. We're getting closer to those pre-pandemic levels. Unique individuals attending was slightly less, maybe linked to the holiday period, but we will be monitoring this. We did see that also in August as well, so I hope we'll see that changing for as long as individuals want to come into the services. That might change come September again. Just in terms of safeguarding, has been referenced already. I would say that we are addressing 88% of the cases within 7 days, completed within 7 days. Those other 12% are being looked at. Don't think we put them on a shelf or anything. They're definitely looked at, but they may take longer than those 7 days. But this is an area we continually monitor, and we try and turn those around as quick as possible. And the deprivation of liberty safeguards, the backlog has slightly reduced. This is due to new staff starting, which is good. Grant funding is being used to support, to provide some additional support and training for our staff. So we've had some Welsh Government funding to support around mental capacity assessments, best interest assessments, so we can speed up, I suppose, the way we're dealing with the DOLS applications, but also ensure the quality remains high as well, and best outcomes for people. I think, that was all I wanted to summarise.
Thank you, Amy.
Thank you.
Are there any questions for Amy?
Yeah, I've got sorry. Cheryl, do you want to go first? No.
Okay, Jeff.
Yeah, I just scribbled a few. Sorry, I'm a bit late, actually. I apologise if you've already covered this. If I just go through all the little points I've got, understand the common access point has actually gone into the Guildhall. Acoustics poor. I think people are actually being given headphones to get over that. What's different to the new location compared to the old? Also, the identified staffing is a problem as well, especially for the coming winter months. Is this a seasonal thing? Does it just happen this year, or is it a common thing? The community teams, again, problems with recruitment of staff, accommodation. Is it fit for purpose now that they've actually come into the Guildhall? Under the mental health heading, social work and mental health are limited capacity to manage workload. Again, I assume this is to do with recruitment, and staff are under pressure because of the workload. I assume that's linked to you just can't recruit staff there. And external domiciliary care, ongoing cost pressures. How bad are the cost pressures? And we're reviewing the price strategy. So what does that mean? We're actually going out to tender again with these people? And that's it, actually. Sorry.
Thank you, Jeff.
Okay, so I'll start with the CAP question. I think I wrote them all down, so just to I hope I answer all these. So in the common access point, all our teams actually who were based on the Civic have now moved over to Guildhall. Last team moved in about 3 weeks ago, so they're all here. I think the acoustics are just they're much larger ceilinged rooms. They're much older building. It's not a more modern building as the Civic was, so the acoustics aren't amazing. And when we say we've got headphones for the team, they always have headphones. We're actually getting them better sound proof sort of headphones, so they're sound blocking headphones, and it means obviously then they can fully concentrate on the calls they're taking, because it's, you know, they're dealing with really complex situations, so we have to make sure that they can have that concentration. So that's the different location. All teams are facing this actually, I think, you know, but our colleagues have been based here for many years, and we're just finding out what others have been dealing with before. So that's the new location. Staffing and recruitment, generally in terms of our qualified social work teams, it is a challenge. It's ourselves and all other local authorities across Wales. You know, there is a deficit in terms of the amount of social workers there are compared to vacancies. There's less people, not less people training so much as there's just not enough people coming through the system, I suppose. So we've got workforce strategies around how we want to develop our own staff internally. So we sponsor people to do the social work degree in terms of courses. So this year we opened up 10 spaces. We filled 7 of those. So we've got 7 people that we're sponsoring via the Open University to train as social workers. And that's just year 1 cohort. We've got people existing on year 2 and 3, but we significantly increased the numbers this year. That's just adult services. Julie's done the same with children's services as well. So we're trying to sort of develop our own staff strategy, but also doing a lot more links to university around hosting those who are on the courses locally in Swansea as well. You know, we want to offer as many opportunities for student social workers. So that's a bit of a strategy, but we're competing in a market where lots of authorities have got vacancies as well. So it's yeah, we know we have to look at why people come here as well and support them. So we obviously think we're the best. So, you know, no, we do. No, we need to make sure that we have those staff offers around wellbeing, you know, remuneration, support for them as well.
There's a lot of support for the staff that you've come in.
Absolutely, it's really key, and also about our alternatively qualified staff as well. So it's about all the staff in our teams and recruitment as well. So it's not just social work; it's also dom care staff, residential as well. So all our qualified teams. The mentioning about the mental health impact, I couldn't find the actual reference. Sorry, I tried to look quickly in the report, but the impact, so that wider wellbeing offer for our staff as well. We've got a number of colleagues really focusing on that. Each team's having a wellbeing assessment in terms of, and then looking at individual action plans, because different teams are facing with different challenges. So I think that's a large part of our strategy around supporting staff wellbeing. And dom care providers. So we are due to look at our commissioning. So we last did it, I think it was 3 years ago. I'm going to lose track of time, but we're due to recommission the services again shortly. So we're looking at that in the next 12 months as well, looking at our options, and a working group's been looking at that.
Okay, Jack? Do you want to
Yes,
come back
okay.
and talk?
I don't think it was 4 years, but there we are, time flies.
Councillor Cheryl Philpott, you've got a question?
I've actually got 3 questions, if that's okay, Chair. Jeff picked up on one of them, which is the cap, the issues with the soundproofing there. Well, the audio. I'm just wondering, Amy, have the officers got the soundboarding structures that surround each individual? Because having worked in an office where it was very high ceilings, we found that the boards, even though you've got the headphones on, we found the boards were really helpful because they help to mitigate some of the noise. So I just wondered if they were being used and whether it is an idea. Do you want me to should I just go through the other couple of questions as well?
Yes, please. Yes, please.
So then the next question is on the external provision, and you noted some concerns. One of the things I was looking at was the continued low occupancy at some homes, creating potential levels of financial instability for some providers. So, and I just wondered, you know, why are those homes? Why have they got vacancies? You know, is it something to do with the quality of care they're offering? But it just seemed really quite strange that they do have low occupancy levels. I know you said as well within the report that sometimes there is a delay, and it's not generally, I don't think, with our social workers sort of like assessments, but there's a delay in actually doing that transition. So I don't know whether that is something to do with it, but you know, some information about why they've got low occupancy levels I think would be helpful, because that picks up the point about the nursing home that you do have performance concerns in. And clearly I would have thought that, you know, for the residents themselves and for families, that's got to be a really worrying time if things have been picked up that, you know, there are areas of concern. Because the thought that came to my head was, what if we've got one nursing home that we have concerns with, couldn't some of the residents there be transferred to some of the other care homes? I know that not all care homes are suitable for each person, but I just wondered whether there was something to do there. And I'll pick up on the third party charges. You've said that many third party charges are now being picked up by the local authority, or more are. I actually think this was the worst charge that was ever thought of by the government. And I really do think that this was a charge that put a lot of family and friends, because I think the wording at one time was it will be family and friends that pick up. If family and friends don't have the money, then I can understand why the local authority is having to pick up on it. But it's not right. I think we should be doing so. I think that possibly as all councils, all social services should perhaps now review those third party figures and perhaps make a representation to the Welsh Government on the necessity for them, and look to increase funding for each care home so they don't have to ask for third party fees. And then the third point is about the safeguarding. Louise also said that obviously there was a little bit concerned about seeing some of the extra referrals, increase in referrals. Do we have examples of what some of the safeguarding issues have been? I just wonder sometimes whether it's a lack of knowledge and expertise by carers, and whether there is some sort of like training development that we could offer to carers, or is it something worse? And also, for what a concern for me was the high number of professional concern referrals. And I'm assuming that is within the external provider system as well. So sorry, I've rattled off quite a few things, but just to recap, it was whether you're using soundboards with the common access point, the concerns over external provision, and the concerns over safeguarding.
Thank you, Cheryl.
Yeah, if I'll just pick up on a couple of those and then hand over to Amy, particularly on the points about the third party charge. There's been a bit of discussion about this the other day. I think this is something that we're looking to, we don't actually have a policy at the moment. So this is something we're looking to take through the political process, perhaps look at it with the I can't remember what they're called now, STC committee, to develop a policy around this so we can have some clarity. It's obviously very difficult because they are private organisations, so we can't sort of dictate about, you know, what they can and cannot charge, but we do need a policy around that and clarity there. Similarly, as you said, the safeguarding concerns, we had a bit of discussion about this. Again, we need to we're doing a bit of work on that, aren't we, and looking in a bit more depth as to where those concerns are, the patterns and as you say, as their training that we can offer to kind of make sure that they're appropriate. Again, Amy would do better to answer these, but yes, particularly the nursing home where there were concerns expressed. I think the teams have worked incredibly hard. They've gone into the home, they've worked alongside the existing staff, and that is now, I think we could safely say, turned around. I think, yeah. I'll hand over to Amy because you've got more of the detail.
Thank you, Louise.
Thank you. I'll pick up in terms of the care home, external care homes. So yeah, there's a care home which is still in escalating concerns, but it's being managed. And I think just in terms of that question about when there's capacity in the sector, why aren't people moved? And I suppose it's in our interests. It's safer and better for people not to be moved. I suppose that's what we're saying, you know, for people's health and well-being, and obviously the impact, and it's people's homes ultimately as well. So we want to do what we can to keep these external care homes stable. But that said, they are external as well. So we have influence because we're commissioners. We work closely with CIW, the Care Inspectorate Wales, when there are escalating concerns. And in the case of a home that we won't name the home, but you know, it had health board funded clients in there as well. So we work with health board colleagues. So we that's the rationale. But in terms of why there are vacancies in the rest of the sector as well, we've got to do some more work on this. I mean, some of this is post-pandemic recovery. Some of this could be the stabilised figure as it is now for Swansea in terms of demand. You know, it might really have changed in terms of sort of population numbers and the amount of people and the acuity of people needing to go into residential or care homes. So it's a bit of a changing picture that it hasn't stabilised yet, I suppose, in terms of post-pandemic, to know what the future looks like. There have been changes over the past year. I think we've got less care homes. No, but not I know we have less care homes. You know, a couple have closed as well in this time as well. So there is often change in the sector. So we have to just wait and see till it's stabilised. And again, as mentioned, probably more than once now, but ultimately these are independent organisations of us. So we have influence in terms of commissioning, but ultimately as well, they're business decisions for them as organisations, some of this. Right. Third party charge has been covered. Again, it's a sort of policy and a political aspect, so I, as an officer, won't comment. The external provision and the delays in people people going into homes as well. Some of this is we wrote it in the report, or just phrased it in the report as well. The team did around it's in individual circumstances as why there's delayed. Really, it's difficult to almost say there's a trend. You know, quite often it can be family reasons. It can be, you know, sort of different children sort of agreeing or not agreeing where parents and family members go. It can be in the courts as well. It can be playing through the courts. It can be about the funding decisions, and all these things are delaying people moving into those longer term care. It isn't those delays that are, you know, a social work assessment, a nursing assessment, etc. You know, it is sometimes those personal things that are going on in those people's lives. So, and as a people-based service, this is going to happen. So that's in terms of the vacancies, and the I hope I've covered everything that's been said. But the last one, the cap and the soundboarding, we don't have that. Interesting. We'll follow up with facilities to find out more. So yeah, it's not something that we use in our teams at the moment. So that sounds really useful and interesting. What I would say is we do work agilely, and so people don't have the same desks they sit at every day. You know, people work in different. Right. You know, we work, but I'm sure that can be accommodated, can't it? So it sounds interesting.
Thank you, Amy. Any other questions?
Yeah, can I just sorry, Amy, can I just come back? I think the fact that the report actually says that there's a high number of professional concern referrals, I think that really does need to be qualified as to where those professional referrals are aimed at, because it could be social workers. I mean, I would like to think that there are no concerns raised at our profession, at our social workers, because I know how hard they work. But if it is external professional concern referrals, so nursing homes or whatever, then I think that we need to give that fuller explanation. Are you with me?
Yeah, absolutely. Sorry, you did ask this. We can do a breakdown. We obviously have to anonymise. You know, we wouldn't want anyone to be identified. But we could do some trends and some information around that. What I would say is we do professional concerns for all organisations in terms of the care and support. So this can be health, this can be people working in the wider health and social care space. So there's a lot of we have to deal with, our safeguarding function is dealing with them for all organisations. So yeah, I wouldn't want you to think it was care homes and or social workers and or, you know, it really is across the board. Sorry, you just reminded me with something with the type of safeguarding referrals as well. Sorry, going back to the safeguarding in terms of those. We do have some information in the report where we talk about where the consultations and the referrals have come from. And what I would say is you'll see in the graph on our page 32, I think it's page 40 in terms of the pack, is showing that we're taking a higher number of consultations these days, much higher number of consultations and a much lower number of actual full-blown referrals. And I think what that's showing is that people are taking advice first and getting that early help and prevention activity before it turns into a report. So we're quite confident in the fact that this approach is reducing the amount of inappropriate reports that we're getting. We still do report on the amount of inappropriate, you know, that weren't safeguarding referrals, but they still come through. And we are seeing a positive improvement there. And we do track where they're coming from, and then the team do direct work sometimes with those sectors where needed. So if we are seeing a higher number from care homes, then, you know, the teams, they'll do some briefing or information or links with partner organisations, both or internal and external care homes. So just wanted to let you know. And in terms of the type of safeguarding referrals, we do have sorry, it's not in the, I think we used to put it in the report, but we can certainly look at that as well. We get those, the breakdown, whether it's sort of financial abuse, whether this is concerns of, you know, other kinds of, you know, what we're seeing. And then the team again use this data and information. We assess it weekly, or they assess it weekly, as shared with me as well. And we can see where those trends are and target work accordingly.
Thank you, Amy. Happy, Cheryl? Lovely, thank you. Tony, your question.
Oh, I've got that on. Yes. Thank you, Chair. Just in terms of the deprivation of liberty information, I don't know whether you have this, Amy, but I'd be interested to know roughly how many people have taken advantage of going through the deprivation of liberty process, let's say in the last year or 6 months. Secondly, what's the balance of the type of the claimant? Is it the individual who feels their personal liberty has been taken away, or is it someone acting on their behalf? So, I mean, is this a very minor issue in the city and county, or is it a growing one because of the way that lives develop and the services on offer tend to change?
I don't have that data to hand, sorry, but we have got a report on dolls coming to you in the October meeting, and I think we can include that information if you'd like. We can put some more detail behind that, particularly in terms. What I say is generally it is it's more. Yeah, I can't tell you a summary. I was just going to say what we're getting is mainly when people's change of circumstances change, and then we get a referral in. So whether someone's moved into a care home and then there's a deprivation of liberty put in. I feel like I'm talking about a lot about care homes. I'll work in other areas as well. But, you know, if there's some level of restriction in, you know, in terms of people's safeguarding, you know, that's when adults application might come in. They seem to be our bulk of them. But yeah, we'll put it in the report in October if that's okay.
Great, thank you. Any other questions from anybody? Question from me, sorry. Legal support, you're outsourcing part of it, and that's becoming quite a increasing amount. Are we employing enough solicitors to take on board that, or is it?
I mean, it's a tricky question. No, so we have, one of our solicitors who was in-house and specialist has moved on to a different position. So we have had a vacancy, but I understand their post is being filled or has been filled now. So, you know, that is being backfilled, but there is an increased demand as well. So I think it's fair to say as well. And there are some quite complex cases as well where we were bringing in external specialism as well to support. We've got some grant funding to support this, but some of this is a genuine increased demand and increased cost as well.
Okie dokie, thank you.
Yeah.
Maybe we should keep an eye on that. Yeah. Okay. Any more questions for Amy and Louise? Okay, and we go on to. Did anybody say anything then? Somebody did, didn't they? No, it's all right. Right. We go on to the Wales Audit Office report, missed opportunity. Lee and
It's me.
right,
Yeah,
Amy.
Thank you. I would like to thank the officers for bringing the report because they've had exceptionally busy summer. You know, it's been well, above and beyond really, and there's a lot going on. So I'm grateful to everybody for all that they're doing. Audit Wales brought the report in, give us the report to December the 1st, 2022. They published it, a missed opportunity, the social enterprises, and it looks really across Wales at the local authorities and how we are working and working with the social enterprises and trying to help them grow. You know, today Amy's here, Lee's online. I can't see anybody else, but they can give you the overview of the findings of the report and the recommendations, and you know, based on our local response. We don't disagree with the report, and you know, we are in a good position now to report the actions to, you know, along and align them to our corporate priority, along with the strategy that's well underway in being produced. So I think the mapping of the current social enterprises will be a good start to engage and develop the relationships between the local authority and the social enterprises. We do have very good relationships with those third sector partners out there, and we've seen an increase in social enterprises. And I think that, you know, this will help now perhaps focus and yeah, and hopefully we'll see an even larger increase next year. So but it's a good start. So yeah, I'll hand over to Amy.
Right.
Sorry late.
Okay.
Thank you, Councillor Pugh. Thank you, everyone. Good afternoon. Thank you for the opportunity to give you an update on this. My name is Lee Campbell. I'm the Tackling Poverty Service Manager, and I'll just quickly follow up from what Alison said there. So, yeah, following on Audit Wales publishing this report, it looks at the strategic approach of local authorities across Wales working with social enterprises, and so by that we mean broadly businesses which trade for a social or environmental purpose, of which there's over 100,000 roughly in the UK, and a great many in Wales working in different areas. In fact, over 60% in Wales work with a specific local region. So it's very local, small enterprises, but they make such an important difference, and they have done, particularly during the pandemic, particularly during you know, very sort of challenging times for service provision. So they're an important role to step up and fill some of those gaps or support some of that provision. But the report that Audit Wales has produced just highlights some of the lack of consistency in the way different local authorities approach and promote social enterprises. Some of them are very supportive of it. Almost all have signposting to information about local social enterprises. There are very few that have sort of dedicated officers, but that are responsible for building relationships with social enterprises. And most don't specifically provide funding for social enterprise developments, but they are providing through grants and other opportunities ways that provide those businesses the chance to grow and develop. So and a lot of this ties back to the Social Services and Wellbeing Act, which places a duty on local authorities to promote the development of these businesses that provide care and support and preventative services. We provide some of that promotion through the annual report from the Director of Social Services, but as the report itself says, you know, some of the definitions, some terminologies are very open to interpretation and gives us the flexibility for every local authority to take a different approach. So what this report is basically saying is local authorities have the opportunity now to do a bit of a self-assessment, see where they are and where they want to be in terms of providing a role in supporting local social enterprises, and then work on a sort of action plan for the changes and the improvements that we want to make. So in the report that we provided today, it breaks down some of those findings. The 3 recommendations in the report itself, we just break down what our responses to those are. And very quickly, so the first recommendation just says we think you should do a self-evaluation using the checklist that's provided in Appendix 2. So we've done that. We've included that in the annex of the report that's provided today, but it's very much a living document. I expect it to develop as we go along, and we do more investigations and more work with our, not just our internal departments, but obviously with local partners, with the third sector, and with social enterprises that we do through the mapping exercises, as Alison said. The second recommendation of the report is that we use that self-evaluation to drive improvement. So to move towards formally developing an action plan, regularly reporting it through scrutiny committees, and ensure that we revise our targets and actions accordingly as we make some of those improvements. In the report, in our response, we've pulled out 11 specific key actions that we've identified so far, and they're all kind of very connected and very sort of they require a process and a flow for us to follow. So, for instance, starting with really defining some of the vision and the definition and the commitment that we want, and that will then lead us to more specific actions to plan and coordinate particular events and activities and projects. There is a lot, as the annex, the table in the annex shows, there's a lot that has started, or at the very least we've got a good idea of where we're at, and we've got good relationships with, for instance, our third sector partners. We've got some good connections in terms of things like social value at regional levels, but I think it's about putting all these things together and using that as a way of saying what the totality of our commitment to action is going to be. So the third recommendation just quickly says that ensure that we are delivering our Section 16 responsibilities against the Social Services and Wellbeing Act, and we've kind of said there that, you know, that is our commitment and that is what we're doing. But I think the action plan that comes out of this work will provide us with more information, more activity to promote and develop these very important business opportunities. So in terms of that's what the report says, and that's what we've done so far in response. So it's given us the catalyst now to share it with yourselves. We will be sharing it with the Governance and Audit Committee for, you know, just for visibility of the commitment to the Auditor General's recommendations. And the action plan that we develop will be something that we'll be promoting and reporting on through our normal governance channels. So I very much, this won't be sort of the last we hear from it, but I imagine that it'll shape and develop a lot more detail as we go forward. And so the next steps really will be to take comments and contributions away, to continue our engagement with our colleagues and our partners and our connections with those social enterprises that we already have relationships with, and to use that all as a way to deliver improvements. That's kind of the summary of the report and everything. Very happy to answer questions, Chair, or refer back to anything I previously said.
Thank you, Lee. Are there any questions? Tony?
Thank you, Chair. I think I saw somewhere in the text a reference to poverty. You're nodding, so I assume that that's correct, is it?
Yes, this is one of 3 reports that were linked to the Audit
Yes.
Wales's review of poverty. So I know we
Yes.
brought the
Yeah.
one last month as well, but yeah, this is
Okay.
the 3rd one.
Can I ask, what's the definition of poverty? Poverty of what? Poverty of income? Poverty of ambition? Poverty of lifestyle? Poverty of instability?
Very happy to respond on that, and it's actually very good timing on that. As Councillor Pugh mentioned, we are currently in the process of doing some engagement work on the refresh of our tackling poverty strategy. So the definition that we've been using in our current strategy is very much focused on things like the minimum income standard, access to affordable goods and services and things like that. So the definitions that we currently use, I think, are open for us to refresh and review. We're already doing some engagement work on that. In fact, we've got a survey that's out now to gain people's views on things like what should our priorities be, and to inform our definition of work going forward. So in terms of how it fits in with this, I think it's a really interesting question to raise, because if we can get the right definition of poverty in place, we can see how social enterprises can be used to address some of that work, some of the definition. For instance, as you mentioned there, about things like poverty of opportunity. So if these are providing people with job opportunities and prospects for the future, or the care and support that people need to get fit and healthy again and to re-enter the employment market, I think there's lots of ways in which we could look at using social enterprises to contribute to that. Hence, I think the title, A Missed Opportunity, of this report is kind of encouraging us to look at that as a way of using social enterprises to address poverty. I hope that answers the question, Councillor.
Okay. Councillor Chris Harley, you've got a question?
Yeah, thanks, Chair. Lee, I haven't looked actually in the minutes to see if there is a list of what the social enterprises are, but obviously some of them are more adventurous than others. Is there a chance that we can actually have a look at them and discuss them at some time in the future?
Certainly, I think that's part of the one of the first steps we want to do is complete that mapping exercise to improve the data that we've got about what social enterprises and other things like micro enterprises, small businesses with less than 10 employees. You know, these are all potentially opportunities that, yeah, we want to kind of bring that information together and present some of that so that we can see what we can be doing and what our relationship should be with those organizations. So yeah, as we pull that information together, it'll be part of the reporting that we provide going forward, definitely.
I'm glad of that, because having seen many social enterprises over the years, one of the best I've seen is the one in Liverpool, which is Big Bob's Movers, which is actually does removal, befriending, you know, of people. So when do you envisage having that map ready so that we can have a look at it?
That I'm hoping that the action planning that we do next will give us some timelines. So I haven't got that information yet,
Right, okay.
but I think it is one of the actions that is going to be at the top of the list. So yeah, we hope we can pull our colleagues together and come up with an action plan very soon.
Okay, thank you.
Thank you. Any other questions? Jeff, Councillor Jeff Jones.
Yeah, leading on from Chris, you know, with regards to, I know you're going to carry out a mapping exercise. I can see in the audit information they've sent out that there's one particular authority in Wales that I think has identified or works with 60% of social enterprises. Where do we, I don't expect you to, where do we actually link in that? Are we one of the lower ones, or we're not the 60%, I assume?
I'll go back and I'll double check that one, Councillor, but I think the the information that is in the report references that I think 60% of social enterprises work specifically with one local authority or in one local authority area. So if you can imagine that a lot, like 100% of the ones that we would work with, then we could break that down into 60% of them are just based in Swansea or just working with our local communities, whereas others may be more on a regional footprint or maybe even a national footprint. So we are trying to understand a little bit more about what that looks like and pull some of that data together, so it will inform the work that we do going forward.
Yeah, yeah. And I can see, you know, some of the turnovers as well. Some of them have got zero, should we say, turnover, whereas others have got over 5 million, I think I said. You know, it's quite large. I can't imagine what that social enterprise would actually look like. But with regards to working with these, I think there's a reference in the paper, something about some sort of leadership vacuum, you know. You know, the social enterprise that shall we say, that we work with, and I assume we actually give grants to as well, you know. How do we measure performance of these social enterprises? Do we lay down expectations, and do we, shall we say, audit these social enterprises to see that they are performing?
Thank you. That's a great question, because I think the answer is from each individual grant's perspective, we would have measurements and outcomes and ways of measuring performance, but they would be very focused on the nature of that grant rather than on their performance as a social enterprise. And I think that's an opportunity for us to connect across various grants and pieces of work to say how we measure in all of these things, how we see what a good social enterprise looks like, and being able to measure that in different ways. So it's definitely an area that in our evaluation we said there's more we can do, and that we can pull some of that information that is already there together to help us as a starting point. So I think we will be able to kind of pull a performance framework of sorts together, and it'll tell us how we can then measure really good performance of social enterprises.
Thanks. Thank you.
Can I just say, I think Jeff has read it wrong. It's not 60% are with one local authority. It means that 60% of enterprises within a local authority are
working with that.
Do you know what I mean? Not like Cardiff got 60% and everybody else divides the 40. Do you know what I mean? It's not. I think we just read it wrong. Do you know what I mean?
Thank you for that. Just a question from me. When are you starting workshops for the elected members to understand this fully?
So thank you, Chair. What we're doing now is we've just put a template together for the action plan. So we're having some sessions with the team and colleagues from different departments to just break down what those actions are going to be. And obviously working with elected members is going to be key to that. So as soon as we've got some information and we've got a message that we can get out to elected members, we'll come to you and ask for your help. That'd be very much appreciated.
Okay. John, you have a question.
Not so much a question, Chair, but an observation, really. I was struck by the phrase that it was in the document about the strategic intent and direction. Now, a number of years ago, the NHS in Wales established the Welsh Health Planning Forum, and it produced a document that was entitled Strategic Intent and Direction for the NHS in Wales with our partners. And it already had some guidance in it in terms of what the sort of aims ought to be. And if I recall them correctly, the starting position was to say we think we want to tackle the 5 biggest causes of premature death, so we can avoid young motorcyclists getting knocked off on the roads in North Wales and so on and so forth. And the 5 big causes of latent morbidity. So that people who've been unwell for many years, some born with conditions and so on that of course a problem. Is that the kind of structure that with our partners, because it was a partnership arrangement from the beginning, is that the kind of framework or something like that that we may be looking to apply across the range of the care that we're talking about?
I'm happy to come back in on that one, and I'm not sure if colleagues will want to add as well. But in terms of the direction that we want to go in is to get everybody to commit to the same path and a strategic line in terms of all of our partners, not just the social enterprises, but our partners in the third sector, our partners in local businesses, social value organisations, and so on, to all be working to the same priorities and actions. So I think the example you've given, I think, is the sort of thing we're talking about, but probably in this context, it would be trying to work out what those priorities would be for us in terms of social enterprises. One example I can think of would probably be, where's the leadership? I think Councillor Jones mentioned about the leadership vacuum comment. So, whose responsibility will it be driving and developing this stuff? Is it a partnership thing? Is it with the local authorities, with the third sector? So if we can get the strategic intent that there will be leadership and there will be governance in place to drive that work, then we can go away and make sure those actions deliver that strategic intention. So it's all about just operating at that strategic level and starting from there in terms of then being able to deliver real improvements.
Thank you, Lee. Nobody else wants anything to add to Lee's
I was just going to say, thanks for that, Lee. I think that's very important with regard to strategic direction and so on. But going back to Alison, I'm glad. I just want to clarify. It says Exhibit 1, just over 60% of Welsh social enterprises work in one local authority area, and less than a quarter in 6 or more. I don't know why I've misread that, but to me that actually says that 60% of social enterprises work in one local authority area, and so that's incorrect, is it? That's page 84, I think it was.
So, Lee, can you clarify better than what I was, because I don't know how else to
I think you were right, Councillor. It's so 60% of them don't go outside of their local area, whereas I think you were saying there that less of them will go, say, on a more regional scale, or maybe operate all across South Wales, for instance. But 60% of the social enterprises really focus on working in one local area place.
Right, thank you for that.
Say only.
It should, yeah.
Only work in one area.
That's right.
Yes. Thank you.
Thank you, Lee. Any more questions on this item? Brilliant. Thank you all for attending, officers, and we just have to do the work plan. Yes. So. Next meeting, actions to be discussed or should they we do the work plan now and with when the officers go, is that? Joking. You can say, right. Work plan. The meeting hasn't finished yet, Michael, sit down. The meeting hasn't finished yet, we've got the work plan to discuss. Sit down. Oh, sorry. And items to be discussed for the meeting that we've got in October, is it? We've got the Director's Social Service Annual Report. We've got a briefing on deprivation of liberty safeguarding dolls and a briefing on CLICE, which is to be confirmed. Yeah, so that's for the October meeting. Have we closed the meeting now? So thank you all for attending. Great. So we are finished now, so go and have a chat.
Okay, thanks, Sue.